management provisions at the employee assistance through the employee assistance program. In addition, the distribution of care packages have been ongoing through the regional health authorities, and that is now including not just food, but we're pivoting towards more cleaning items, water boots, rubber gloves, cleaning material, to help our staff members to clean up their own premises, their own environment, as they seek to get back to normality. So our staff welfare program is very active. There are other plans to engage. We have had meetings with the NHT also to look at some of the offerings of government, and we'll continue to have these interventions at the community level, led by Minister of State Lee. And again, I want to thank her for her efforts and her leadership, and thank the team members who have been working with her at the regional level and also here at this level. In terms of the repairs to hospitals, the National Health Fund, working with the ministry, has adopted the Government of Jamaica emergency procurement methodology, which has activated repair works at 4 of the main hospitals in the affected health regions. And so we have seen work commenced already in the critical institutions, the Black River Hospital, Sablamar Hospital, Noel Holmes Hospital, and Falmouth Hospitals. More details will be provided on this in the coming weeks, but the important note here is that we now have work that have commenced in earnest to restore these major institutions, and Cornwall had already started, just to be clear, to ensure that missing roofs are replaced, to ensure that electrical systems are checked to make sure that they are functional and not pose a danger because of water intrusion, to ensure that the cleanup of these premises take place so we can transition into those buildings, in some instances at least initially, until certain other things take place. And let me tell you what those other things are likely to mean. As part of the overall transition program, we are engaging a technical support team through our collaboration with the Inter-American Development Bank to conduct a review of the ecological feasibility of 3 healthcare facilities. This is very important. This is to determine if these hospitals should be identified located on the premises that they currently exist. So these institutions are Black River Hospital, Noel Holmes Hospital, Falmouth Hospital, all institutions that are located literally on the coastline and that have been severely damaged by Hurricane Melissa. The assessments are aimed at answering the very critical questions of whether these hospital plants located in vulnerable seashore areas can remain, given the vulnerabilities due to climate change. And as we seek to build back better, we're trying to ensure that we create a health system that is not only responsive to the needs of the population, but also to the changing dynamics in the climatic situation that we're currently experiencing globally. More severe storms, of course, being a critical indicator of that. This study, therefore, is a function of a partnership with the IDB. We have had meetings already. A terms of reference has been developed. An appropriate entity will be secured to do that ecological study, and the results, and it's a rapid study, so we're hoping to have some results in the early new year, and that will then form the basis of determining the reconstruction and redevelopment plans for those institutions. So while we are now doing work to restore them for usage, that work is limited to some extent while the more significant study is done to determine longer-term improvements, upgrading, which could include possibly relocation of those institutions. And that will be integrated in the overall government plans as it seeks to build back the country generally stronger, including all the necessary institutions. The operating theaters I wanted to comment on. I want to start by thanking Dr. Elon Thompson, who is a senator, Elon Thompson in the upper house. He's a medical practitioner, urology specialist, who is based at Spanish Town Hospital, but obviously has agreed to do public service. I'd ask him to assist us in assessing our operating theater capacity and equipment status across the affected hospitals. He has done a very good job, submitted a very important comprehensive report, and the assessment covers 5 institutions: Falmouth, Cornwall Regional, Savlamar, Black River, and Noel Homes. Total of 13 operating theaters were reviewed across these facilities. 3 were fully functional at the time of the assessment due, only 3. Significant infrastructure damage, including roof loss and compromised internal areas. Some equipment damage driven by water exposure and utility disruptions, particularly electricity, water supply, and medical gas systems. Key among the findings were that multiple pieces of theater and sterilization equipment sustained some water damage. Some can be repaired based on the assessment. Others may require full replacement. And there's an approximate estimate of about $7 million, 7.1 to be exact, coming from Dr. Thompson's report for replacement of these equipment for operating theater, equipment and building. Now, some of that work has started. As I said, there are contractors re-roofing or roofing, and the drying out of some of the areas and the equipment may determine more to be workable. I want to just place on record that we have a recovery plan as it relates to operating theaters, which is to align the infrastructure repairs of each facility to restore functionality within our operating theaters within, I would say, between 2 and 3 months. So certainly going into January, February. And that work has commenced, and we are looking at Falmouth and Savlamar hospitals in particular as phase 1, with others. In fact, we're looking at all. But I wanted to mention this because it does impact elective surgeries. We are able to do emergencies and are doing emergency surgeries, life-saving surgeries, but it will result in some delay as it relates to electives, and we just want to bring that to the public. But the work has been done in terms of the assessment, and Dr. Thompson, I want to thank him again for that. More will be said on that in the time to come. In terms of field hospital update, in terms of Savlamar, courtesy of the Barbados government, that facility is now fully operational, staffed by approximately 70 medical pediatric, 43 general surgery, and 17 pediatric. So the field hospital is working, and again, thanks to the Barbados government and the local team at Sav Hospital. 6 to 8 patients are admitted daily, with up to 4 surgeries conducted. And we want to thank the team there again, filling that void while we build out the regular building. Black River continues to work with Samaritan's Purse, but we are now in the process of looking to relocate the Black River Field Hospital to the Black River Hospital property from the Black River High School, where it is now located. The move is we hope to be completed by December 14th, and the intention here is to consolidate services, given that the Black River facility is now cleaned up. Some services are going to be restored there, given the work that is taking place, and the staff are better able to coordinate the management of patient care at the same geographic location. That, we believe, is the best approach. We are in the process of training our local team, working with the JDF for that relocation, but also for maintenance of that, of the equipment and the facility itself, which is a very complex facility, having several services, oxygen generator, desalination plant, and other things. And so there is a transfer of knowledge that is taking place now, which is a positive thing. I want to really commend the Samaritan's Purse team out of North Carolina, an NGO. They came in early with our invitation. We facilitated them. They've set up early. They were on the ground. They were providing critical services with their full team. They are now looking to transition out of the country. It has started and will continue. They will facilitate through training and knowledge transfer and the move of the facility. And they will leave the field hospital behind with remote support for our own local team to use. And that we appreciate SIG a lot. In fact, I'm to be there tomorrow, Friday, to have a small thank you mingle, if you will, with the Samaritan's Purse team and the local team on the ground. And I really want to recognize them for that. They have seen over 3,800 patients, including those seen by the mobile medical teams. 2,600 have been seen at the hospital, 99 surgeries performed, and 218 patients requiring admission. So excellent work, and the satisfaction level of patients have been very positive. And of course, our local team, health team, have been giving support while still reserving some time for themselves. It raises the issue, which I'll go to next, of the transition plan for the NGOs who are here. We have hundreds of health workers coming in that we have facilitated to work and to support our team in the field. 6 weeks, over the last 6 weeks, we have seen a number of them come in, which includes the field hospitals. And as they have been able to fill the gaps, we have been able to work with our local team members to begin to restore some sense of normality. The work of these teams are not permanent, and we are now seeing the signs, the indications, the notifications of gradual withdrawal in some instances. Not all immediate, but in some instances. The Spanish field hospital at Falmouth has already was dismantled, and they have moved on to other challenges elsewhere in the world. So Falmouth is now on its own again. Samaritan's Purse will gradually move out starting this month, but they will leave that field hospital, which we will assume control of. We have a transition plan, and the Chief Medical Officer will speak more to that shortly. But I just want to reassure the public that to the extent that our support team, external support team, have been here with us and are now looking to leave over the next weeks into months, we are transitioning, and we have developed a plan to make that transition. In terms of the National Health Fund, 90% of public sector facilities for pharmacy services have resumed filling prescriptions. The remaining 10% experienced major structural damage and are being monitored and provided through mobile services in St. James, St. Elizabeth, Hanover, and Westmoreland. The mobile units have processed some 4,440 prescriptions for more than 3,500 patients across 62 hard-to-reach communities in the West since November 1. 102 outreach community visits were conducted in the affected parishes, and those efforts are ongoing. Since the December 11th and Friday, December 12th, the mobile units will be operating in St. James, Cambridge, Hanover, Chester Castle, and Mount Peto, Westmoreland, Cornwall Mountain, and Big Woods, St. Elizabeth, Newmarket Health Center, and Vineyard Square. And up to December 7th, some 292,000 prescriptions have been processed bringing the number of prescription filled on par with a similar period in October, demonstrating the effectiveness of the NHF response. So the NHF has risen to the occasion also. Another of our critical health agencies, want to commend them. Where the buildings are inoperable, they have used the mobile services, and as the numbers suggest, they have continued to do so, and there's a target over the next number of weeks going into the holiday season. Holiday seasons are very important, and we must remember that we need our medication to take us through. I want to just comment quickly on the Chinese hospital ship mission, the Arc Silk Road. Has generated a lot of excitement, a lot of positive excitement in the country, and for those who have benefited, have been very pleased with the services that have been given. Want to again put on record another critical bilateral partner, the Chinese government, sending the newest fleet in their contingents of mobile hospitals, 300-bed facility with all the necessary diagnostics and operating theaters. And the ship has made 3 stops, which I'm told is historic for any one location. It normally stops at 1 port in each country. It is now in Falmouth, having left Kingston for its final stop, and will remain in Falmouth for from the 12th to the 15th. On the 16th, I believe, it departs onward to its other destinations. It's been historic too because of the numbers of persons that it has seen, bringing much relief to Jamaicans across the 3 geographic locations. The ship catered to patients of the health centers and hospitals in the western region over the 3 days, with close to 2,000 patients seen and some 277 surgeries completed. The ship just concluded its 3-day stop in Kingston, where it saw some 2,766 patients and completed some 206 medical or surgeries, 206. So they did better in terms of seeing more persons here in Kingston over that 3-day period. Today it's heading to Trelawney, should be there now, and will be there, as I said, for those dates. Again, a big thanks to the government and people of China for this support. I've been on the vessel at least 2 or 3 times. It's really a sight to see, amazing, very technologically advanced, and offering critical support with its over 100 health personnel working with the regional authorities. Of note, I have to mention it, the operators, leadership of the vessel have been, and the ambassador, Chinese ambassador, have been very complimentary of the local team and how they have accommodated the logistics and the patient selection, the patient logistics and access for the vessel. In other words, our local team rose to the occasion and did well. And I want to just commend them for it. Our head of emergency medicine, our regional authorities, and all around, I think it was an excellent example of critical coordination and some amount of knowledge transfer also on emergency response. So thanks to all. In terms of vector control and waste management, we continue to work across communities. At the November 30th, 1,347 communities have been visited and treated, with interventions targeting both groundwater sources and container habitats. 713 communities have been fogged to date. 100 communities targeted for initial intervention post-hurricane. 89 communities have been visited and treated in St. Elizabeth. 110 fogged, 34 flooded communities oiled, and several communities required multiple visits. For Western region, 229 statin communities, 90% or 204 have been visited. 144 high-risk communities, which is 91%, 130 have been visited. And over 75% or 524 high-risk communities have been visited and treated island-wide. So the team again has been out in the field, and this is a team that we have expanded with both infrastructure and personnel. Hence, again, the relationship between the decline, or at least the below average figures around dengue and even foodborne diseases. And the team, again, must be commended. The focus for December through January is to intensify interventions with the goal of reducing the BRITU index in all high-risk communities to below 25, minimizing the risk of mosquito-borne disease transmission. So the ministry is going to be active during December, the team. As it relates to water safety, the ministry has distributed approximately 2.6 million chlorine tablets to the regional health authorities. They are actively distributing the same in the most affected areas. Already, the western region has distributed more than 400,000 to several affected communities, and we encourage the population to continue to take the necessary precaution as it relates to water. So all around, again, and I know it sounds like we're singing praises continuously, but when there's bad news, we have to confront it. When it's not bad, and indeed it's good, I think the team deserves commendation, and I'm not taking credit. I'm saying the team have done well in managing the process to date. We're not getting complacent now, but I think we have to commend them. In terms of mental health, a lot more will be said, or more will be said by the Chief Medical Officer or Dr. Goldburn on this. But the team has been working with the Pan American Health Organization and other players to structure a long-term mental health response on the affected areas. And that continues. Psychosocial support is going to be absolutely critical going into this season and in the months beyond next year and maybe year of 2026. 2026 should be declared a mental wellness year for Jamaicans and indeed for those who have been impacted by Melissa. And we have to find a way to coin that phrase and make it a standard narrative where it's no longer an exception in terms of service, but it is mainstreamed in the most significant way. I just met a short while ago with the regional director of UNICEF, who's here on a 2-day visit and tour, and collaboration continued to be discussed of how we strengthen, among other things, the mental health response for children. And we're going to be pushing on that in a significant way. The priorities include activating the mental health response on a national mechanism, reaching out to vulnerable groups and shelters, high-risk communities, caring for carers, healthcare professionals who are very important to this process, and the action will be bolstered by healthcare promotion around mental health. And again, Dr. CMO, Dr. Bisesa Mackenzie, will speak more about that. I'm rushing because we started late. My apologies. I want to just speak quickly to the holiday season before I hand over. It's a lot I know that we have said already, but the season is fast approaching, and we want to ensure that the population remains vigilant at this time. Normally, by next week, everyone will be focused around the season to bring good cheer, season of family, season of merrymaking. You would have heard the Office of the Prime Minister through the Minister of Information announced around government's decision to suspend the normal mode of Christmas cheering through department parties and so on. And it's a difficult decision because, it is a time when we're accustomed to a particular type of activity. And it's not to say that we shouldn't be encouraging each other and wishing them all the best. And I don't think the intention either is to say that within an office context, an office can't bring its team together and bring good tidings of joy. It's just the grand outings and the parties and the booking of venues and music and all of that is normally the case. The government has decided to suspend, and with good reason. The good reason being that we have almost 40% of the country that are in a mentally challenging circumstance, physically, emotionally, and otherwise. And, they're going to have to go through this season in an extreme case, still in some instances trying to come to terms with their own case position. We in health see this as a public health challenge, among other things, and we want to be a big part of leading a charge to supporting the communities. But it's a charge that all of Jamaica should recognize. So while we give God thanks for our own lives and what we are blessed with, as we should every day, but certainly at the end of a year, and recognize the meaning of the season. The meaning of the season also is to help those who are less fortunate. That's what the Christian teaching tells us. And I don't want to be overly philosophical or biblical, but I really want to make a special appeal to Jamaicans to find time to reach out and give some support in whatever way. That's really psychosocial support in whatever way we can. Now, we in health are insisting on things like, managing your non-communicable diseases, diabetes, high blood pressure, asthma, cancer, sickle cells, heart disease, depression, to continue your medication regime, very important. We really can't manage a peak demand of hospital services this year. Well, we would rather not have it. We will manage if we have to. So the team is always ready, especially those hospitals that are challenged. So avoid the temptation of overindulging if you think you have the wherewithal so to do. The excessive consumption of alcohol, food, the drinking and the driving, those standard teachings of not good behavior or practices that could lead to a requirement for hospital services. And instead spend that time helping those. Visit someone, take a meal and have it, help the children with back to school supplies. Many have lost their personal belongings, and whatever else can be done just to provide some encouragement. For patients who use insulin and are unable to store it in a refrigerator due to power outage, we're recommending that you store in a cooler or igloo with ice packs or in insulated bags to keep it cool. Do not place insulin directly on ice. I am being told by the clinicians, we'll send out those advisories. If no cooling option is available, insulin should be kept in a dry, cool place and must be used within 30 days of opening. So proper storage is essential for this. So you will see more of this kind of advisory as we go into the season, even while we have the outreach into communities. And then this time of year, of course, one can be either very happy or very sad, so we ask for the outreach and the support. Spend quality time with loved ones, reach out to relatives, community members, co-workers who you know may be at risk of loneliness at this time. Practice self-care, get some rest where you can, taking medication when needed, maintain your diet, healthy eating, and we will continue to provide updates and provide an avenue for persons to speak to us through our 888 New Life number. That's 888 New Life. And young persons 18 to 24 can chat free, confidentially, and anonymously with our You Matter counselor by texting the word support to You Report. That's You Report, or 876-838-4897 on WhatsApp, and SMS free text for Flow customers, or at UREPORTJAMAICA. That's You Report Jamaica, at You Report Jamaica, or Instagram or Facebook messaging. And then the road traffic accidents or road traffic potential accidents, aside from vaccine-related illness or viral illnesses, we're mindful of the roads and the dangers on the roads. Please be careful during this season how you drive. Don't drink if you have to drive. And we're making a special appeal, especially to young men who tend to be the ones to overindulge. In those parishes, I have to say, St. Elizabeth, Westmoreland, the bikers, riding without helmets, that's where we get most of the hospital crashes. Savlamar Hospital and Black River Hospital will have a challenge catering to these bikers coming in, because they're intoxicated or taking unnecessary risk with the helmets, without helmets, and coming with the head injuries. So we appeal to you, please be careful out there. And there are some advisories here around not operating mobile phone devices while driving, wear a seat belt, wear your helmet, avoid drinking and driving, all the issues that are critical. I want to raise one other thing in preparation for the season, social cases. Our hospital at any point in time would have I would say between 3 and 10% of beds occupied by social cases. Those are cases of persons who really should not be in a hospital, in some instances being dropped off by relatives or just abandoned. We have challenges now as we speak. Our hospitals, particularly in the zone, are having a real challenge accommodating social cases where bed counts are already limited. In fact, we have persons now that are at Falmouth Infirmary, who were transferred from Cornwall Regional Hospital, just to give a case. That infirmary was decimated by the storm. There's nowhere to put them. 30 such cases. They are now being housed at a school in Trelawney, and we're going to have to find an alternative before school reopens. I give you that case as how the challenge constitute real impact on the ground. These are people. We can't abandon them. We can't put them out in the street. Many of them have relatives. Some of these relatives have chosen not to care for them, have forgotten them, and they are left on the state. And in case of the infirmaries, which is under the local government ministry, the infirmary was destroyed by the hurricane. So the dilemma now is we're going to have to build and in the meantime find somewhere to put them. It's a real challenge. We really would like to discourage that and encourage persons to take care of their loved ones during the season. So that's been a lot from me. I will stop here. I do believe we're doing the best that we can, despite the fact that we can always learn and to do more and do better. But the reality is that we're responding, and I want to thank all the support that we have had. So I'm going to turn over now to Dr. Webster Carr, and then from Dr. Webster Carr, well, I'm going to turn over to Stephen, so Stephen can take it from here.
All right, thank you very much, Minister. So we're going to take the presentation from Dr. Webster Carr, the epidemiological report.
Thank you. Morning, everyone. We are going to be looking at the data that would have been collected from our routine and enhanced surveillance system to include leptospirosis, respiratory infection, gastroenteritis, and at shelters. For leptospirosis, we, as of yesterday, would have seen 91 cases post-Melissa, of which 30 are confirmed, and 12 deaths, of which 7 are confirmed. With respect to when we were seeing these cases, Hurricane Melissa was in week 44, and we are now in week 50. In week 46, we would have seen the highest number or the greatest number of cases in week 33. When we look at the sex and age distribution, men are at greater risk of contracting leptospirosis, with about 84% of cases being male, and 100% of deaths are among male. Persons 20 to 29 are particularly at risk for cases, and persons over 60 for death. When we look throughout the country, this is the distribution, but let us drill down in what is happening every week. So the next slide will show the cases around week 46 as the national picture looks. There are some parishes, such as St. Anne and St. Catherine, which week 47, but what we are seeing overall is that the cases seem to have peaked in all parishes. So what do the numbers mean? The leptospirosis outbreak appears to have peaked in epidemiological week 46. Males have a greater risk of contracting leptospirosis, particularly those in the 20 to 29 years age group. This is probably because they are out probably cleaning up post the storm. Males have a greater risk of death, and especially males 60 years and older and males in the 20 to 29 age group. With respect to dengue, it continues to be at low activity, so we are not even seeing the seasonal level of dengue at this time. But the risks still remain, as the dengue season usually continues to the early part of the year. With respect to respiratory infections, acute respiratory infection are within normal, and while some indicators show that we may be in season of influenza, some are not, are lower than seasonal levels. So if we look at the chart with the cases, with the number of positive, influenza, respiratory syncytial viruses are what are circulating. At this time, we are not really seeing much COVID-19. With respect to gastroenteritis, we are within normal limits for week 49. That's last week. Accidents, still, Westmoreland is in epidemic levels, and Kingston and St. Andrew is in epidemic levels. Maybe related to repairs, but so we have to be careful. And finally, we'd like to look at what's happening in the shelters. The numbers in the shelters are decreasing. We're at about 1,086, but we are not seeing any of the syndromes that we are checking for, whether it be diarrhea, fever, or respiratory infection. Thank you.
Thank you very much, Dr. Westcott. Now we'll turn to our Chief Medical Officer, who will give us presentations on the transition plan as well as our mental health response.
Thank you, Stephen. Morning, everyone. All right, so Minister has spoken about the field hospitals, and just to give you a quick overview of where they are and what will happen over the next couple of weeks. So first of all, I want to look at the field hospitals themselves that are within the hospitals. We have 4 hospitals with a full field hospital, meaning that the tents are fully equipped and they come with staff. And we had that at Trelawney. That field hospital has already left, and the hospital is trying to return to normal, but they are constrained because their bed capacity has been significantly reduced, as well as there was significant damage to the accident and emergency department and the operating theatre. Over the next month, we expect to see that significant repairs will take place. Patients are now being seen. The accident and emergency department has been relocated to where we had the previous field hospital, which was a COVID field hospital, and we are restoring some services. Over the next week, the Chinese hospital ship will be in Falmouth, and so therefore we expect that there will be some elective cases, surgical cases that will be done there. So that field hospital has already left. We have the field hospital in Black River, St. Elizabeth, and for that field hospital, we expect that they will wind up activities by the 20th of this month. Now, in preparation for that, the Black River Hospital and the Southern Regional Health Authority teams are being trained to operate, manage, and work in the field hospital. And the field hospital will move, the physical structures will move to the Black River Hospital compound. So this week they are finalizing the area. The ground is being prepared to receive the field hospital. We expect that that will be completed by the 14th of December, and that next week we will start moving over the field hospital, and that will take about a week. As these tents move over, then we will start operations in the field hospital. So will be, starting next week, a gradual operations from the field hospital on the Black River Hospital compound. And the Black River Hospital staff will be working along with the team, this Samaritan Purse team in the field hospital on the compound next week, as we gradually increase the number of spaces that are moved over. So by the following week, we expect that the Black River team will be fully operational within the field hospital, which will be now on the Black River compound, and they will be therefore able to offer accident and emergency services. They will have limited operating theatre services, and they will have ward space, although limited. And we expect that by the end of January, that some of the buildings will return to use and their capacity will increase. For Westmoreland, the field hospital there is staffed by the Barbados Defence Force and the team, the medical team that goes along with that setup. And they are providing some essential space in terms of the operations of the outpatient department. And that field hospital, we are hoping that they can stay a little bit longer, so we are waiting to see the response on that. But the critical space that we're trying to return to some use is space for outpatient department. And over the next month, going into January, there is construction being done, repairs to an existing building, as well as new construction, which we hope that we will be able to accommodate some outpatient services if the field hospital moves away in January or even later in December. The operating theatre services are being provided by the field hospital, but also measures have been put in place to restore the operating theatre services at the hospital to use. Not everything is in place, but surgeries are being done there. And we expect that the repairs will also bring back on some ward space so that we'll be better able to accommodate patients. In Hanover, we also have another field hospital that is being operated by the Spanish team. And that field hospital is presently housing the accident and emergency department. That hospital is expected to leave in January. Right now, the date is for the 9th of January, but we are expecting an extension on this date. And when that field hospital moves over, the accident and emergency department will return to the accident and at the space at the hospital that previously housed the accident and emergency department. As outside of the tents, the actual field hospital with equipment staff, we also had a team at the Cornwall Regional Hospital it was a team with doctors and nurses that was supporting the accident and emergency department, and they were operating out of a tent that was provided by Samaritan Purse. They wound up their operations this week. The time that they spent at Cornwall Regional Hospital allowed for the staff to have some rest and some time to be able to sort out some of their personal challenges. And so they are now prepared to return to normal services within the accident and emergency department as of next week. The tent space will still be there and will provide additional space in case it is needed. And we are expecting that another solution is to come on board in terms of providing additional space for Cornwall Regional Hospital. And we will let you know more about that as we are certain what is happening. We had 2 other teams that were stationed at 15-member teams, doctors and nurses that were stationed at Mandeville Regional Hospital and at St. Anne's Bay Hospital at the critical period right after the storm, where it is that they experienced great surges and you had patients moved out of the hospitals to those areas. Those teams have stayed for 2 weeks and they have left, and the hospitals have returned to normal services. Next slide. For primary health care, again, we have teams that are right across the 5 parishes that have been severely affected. So in St. Elizabeth, we had a tent that was set up at the Black River Health Center, and also one that was set up at middle quarters. I think it is middle quarters. Can't make it out from here. But those tents were donated by Samaritan Purse, and they will remain there. And teams from the local health department are visiting those areas along with all the other health centers. So they will continue to operate from those areas until the buildings are restored. And pretty much for St. Elizabeth, all their services in terms of routine schedules at their health centers have been restored, whether it is in the health center infrastructure or a nearby building or from a tent through outreaches. But they have pretty much restored their schedule of services. In Westmoreland was supported by a team, Rubicon, that has been working out of the compound at Savlamar Hospital, as well as have been doing outreaches and have been providing service at the tent that has been placed at Bluefields. Bluefields community, it's not at the health center where the health center was, but at the community center. And the Rubicon teams moves between Savlamar Hospital and Bluefields, and they also do outreaches to other areas, communities that have needs. And that team is expected to stay for the month of January, so that they will continue to provide support. A lot of the health centers were affected I would say all the health centers in Westmoreland would have been affected, and so there is a lot of outreaches. And so the additional manpower on the ground have helped the local team, to be able to deliver services on a regular basis. They are also supported by another team, which is the Red Cross team, which actually has 2 teams that they are also expected to stay for the month of January and possibly beyond January. So those teams will remain to support the primary health care network within Westmoreland. In Hanover, we have a tent that is set up by another group that is in Chester Castle. And that group wound up their operations this week, I believe. Now, the local team would have been working with this team, and they will continue to offer the services in that area of the Hopewell Health District in Ramble and Mount Peto. Mount Peto is back to normal functioning and is offering expanded clinic days to support the community of Ramble and Chester Castle. So the tent structure will probably remain until we have a secure building, but within the community we have also identified a building that can be used, and so the services will continue there with the local team. In St. James, we would have had a team that is supporting, I think this is Heart to Heart, that is supporting the St. James Health Department, and they are mostly working out of Cambridge Health Centre, but they really have been assigned across the parish to provide support. There is also in Trelawney another team that is working out of Wakefield Health Centre and is also providing support. Now, these teams are expected to wind up between now and the end of December. And the local teams have resumed their normal routine schedules. They're trying to, once teams are there, the additional teams, then they're doing as much outreaches that they can do. The visitation to the shelters, they have ramped up on those. But once the teams leave, then the local teams will continue. In addition to that, I would say that there are local teams from the rest of the country, certainly the University Hospital, the Medical Association of Jamaica, the Emergency Medicine Physicians Group. There are several groups that have been going into the parishes that are providing support. Not as structured in that they're not assigned to areas, but they have been provided much needed help, and they will, I expect, will continue to provide some support. So all in all, while it is that the teams are pulling out, there are some that will remain for the period of January, but the local teams are returning to their normal schedules and will continue their services for primary care. And then we had the ship, the Chinese hospital ship that would have provided additional support in Montego Bay initially, and then in Kingston, and now for this week in Falmouth. So all in all, I would say that for the period, the last 6 weeks, we have had significant support from foreign medical teams, local teams from other side of the country, from the Chinese ship, that would have helped in this very strenuous right after the disaster period. And as this would have allowed the teams on the ground to have gotten some rest, it would have allowed us to do more outreaches, get into more shelters, more communities. We are returning to our normal schedules, but we have a variety of our community health worker teams that are out there, health promotion, education teams, our vector workers team, a lot of teams that are out there that are continuing to provide the support in the shelters and in the communities.
Thank you, CMO. So you'll now turn and give us the mental health update.
Yes, thank you, Stephen. So this presentation, thank Dr. Goldburn, who is sitting beside me, for preparing the presentation. And Minister has said some of the points that are here already, but important to note that the mental health team at the Ministry of Health, working with partners, in particular PAHO, have activated the mental health psychosocial support coordination under a national mechanism. What it means is that we and our partners are sitting together to plan to how it is that we will reach to the population right across the island, but particularly so in the very heavily affected parishes, to provide the support that is needed. Importantly, a communication campaign has been developed, and we have heard the messages on the radio, we've seen them on social media, and we've seen them on the television as well. The communication campaign may not necessarily, in terms of the mediums that are used, may not necessarily reach to the persons in the badly affected areas, but we know that Jamaicans have relatives in every parish, and a lot of persons are visiting the parishes, and we do hope that these messages on how to cope, on what to do, on where to get help, that some of the persons outside of the disaster areas, when they go into the parishes, they would provide this kind of support to persons that need it. In particular, psychosocial care for the vulnerable groups, especially those in shelters and those in high-risk communities, are being targeted for the mental health psychosocial support. We also must not forget the healthcare professionals and the other care professionals outside of health who will also need that kind of support to be able to continue the difficult tasks that they have. We have relocated the psychosocial teams that are in the other areas of the island, in particular the PM Plus, Problem Management Plus trained persons have been visiting in the communities that are affected, visiting the shelters and providing support, and they go into that area for a day, sometimes 2 days, and they're able to provide support. So the communication strategies have been developed in collaboration with PR and our health promotion and education teams. And we have provided more brochures, flyers, provided more public service announcements, and importantly, we're using town criers to get the messages out into the areas that do not have access to these. And a reminder of the availability of the National Mental Health and Suicide Prevention Helpline. The number is 888-639-5433 or 888-NEW-LIFE, or text support to You Matter Chat line 876-838-4897. In terms of how it is that we are expecting to reach so many persons that have been affected by Hurricane Melissa and its aftermath. Certainly the ministry cannot do it on its own. And we have had several partners that have come in to assist. In terms of government ministries, we've had non-governmental organizations, 13 of those, the Jamaica Psychological Association, the Jamaica Psychiatric Association, Jamaica Red Cross, CTAC, Cali Journeys from Sandals Foundation, True People Consulting, Caring for Miracles, Israel Aid, UNICEF, Ferguson, Caribbean Women in Leadership, Stilled Soul Mental Health Coaching, and Project Hope. These have been our partners, and I'm sure there are even more that some of them they have not gotten all the information for, so that we can list them. And that's why it's so important that all the teams that are out there report into our data collection process so that we can know the persons that are there on the ground. But these are the teams that we know of that are on the ground and that are working with us to ensure that we are delivering quality service of uniform consistency to the persons that are being reached. Now, in terms of the operationalizing of the mental health psychosocial support, we have trained over 1,250 persons to deliver psychological first aid messages. Our target is to train over 3,000 persons. What it is that we want to do with these 3,000 persons? Our target is over 200,000 interactions for persons in the target areas, in the heavily affected parishes. What is psychological first aid? Psychological first aid will provide the persons that are trained and the persons that they reach with the information that they're able to provide some support for persons where they are. And one of the basic things that we want to ensure, and we want the messages to be about, is that we want there to be considerations, social considerations in basic services and in security. So our messages, and for the persons that are trained, is to say that wherever within basic services that we offer services, that we must have some consideration for the persons and understand that we are reaching out to, that the persons that we are interacting with, persons that contact with us, that we can be able to provide that kind of care for them. We always talk about customer service is poor in some areas. This is psychological first aid will impact on that, the training to say in terms of basic one-on-one contact that we offer courtesy and consideration for the issues that persons have. And so the training that we're doing is targeting not just healthcare professionals. We're targeting school teachers, guidance counselors, security forces, community workers from the different ministries, churchgoers, community leaders, all the community groups that there are. We're targeting these persons and all the persons that deliver services. So for that basic service in terms of treating persons with consideration and with dignity and respect, that can happen at the very basic level. What we expect also is that knowledge will translate into the next step, where it is within communities and within families that kind of support is provided. So persons understand what it is that persons are going through and are able to pick up on certain things that they will be trained on and be trained on what it is that they are to say, so that within the community and within the family we can provide support. And then we will have our more specialized groups, where it is that we have persons like healthcare providers who are not necessarily specialists in psychiatry or psychology, but they are trained to be able on each interaction to provide some kind of psychological support. So it's about recognizing what persons are doing and having some basic knowledge and skills so that we can help persons to get over that hurdle, provide that kind word, that pat on your shoulder, that hug that is going to make the difference. And these persons are, as I said, trained from all different areas, and especially in our schools as well, our guidance counselors and our teachers, to be able to provide that one-on-one support. And then in terms of the network that we are creating, the referral system is in place so that these persons, where it is that they need specialized services, that they can be referred to these specialized services. So what have we done so far? So far, we have reached over 500 healthcare workers in terms of providing that kind of psychological support. In one of the first slides, we said that carers for the persons are very, very important. And we have made a very targeted approach to have in our hospitals this kind of intervention to provide support for doctors or nurses, our community workers, all the persons who will need that support. We have reached 3,475 other persons, inclusive of children. 10 persons so far have been referred, and that they require more than that kind of psychological first aid. We have had group sessions, the creation of child-friendly spaces. We have had our outreach, our psychosocial support teams have visited shelters, community sites, health centers. We are having challenges, as we noted when we show our list of persons that we have that are engaged, that we need to have timely updates and the reports coming in, because I'm really certain that we have reached over 3,475 persons with the various teams that are on the ground, because we have several layers of teams that are on the ground, including our mental health teams and our community teams that are going out, as well as all the visiting groups. Timely updates of the information. We have circulated our data collection sheet and for persons to update their information as to the number of services that are being provided. So our next steps is to ensure that we have identified high-risk communities, and we have to ensure that these high-risk communities are being reached by the psychosocial teams. As I said, we've had the PM Plus teams that are going out into these communities. They're leaving from Kingston and they're going out into the communities, and more of these teams are being formed that they will be visiting these high-risk areas. And we are scheduling the teams to visit on a regular basis so that it is not a one-off situation. We're trying to put these psychosocial teams in, for example, community centers or in churches on a regular basis, maybe once a week or once or twice per week, depending on the demand, so that persons will be able to have, for those persons who need more than just that one visit, that they will be able to bring them back over a 3 to 5 week period so that they can get the counseling that they need. So thank you for your attention. It is our aim to try to reach as many persons as possible, not just through the regular means of the healthcare facilities and the healthcare teams, but to train over 3,000 persons to be able to deliver over 200,000 interactions over the coming months. And we're hoping that with that, Minister, we will be able to put persons in a better position to be able to recover better from the hurricane.
All right, thank you very much, CMO. So we're going to go quickly to our media colleagues on the Zoom to see if they have any questions. We're asking them to use the raise hand feature on the Zoom. So if you have a question, just allowing our media colleagues, if they have. So acknowledging Christopher Thomas.
Am I being heard? I'm not hearing any response. I don't know if I'm being heard. Okay.
You can
put
your question in the chat.
Hearing another echo, and I'll have to type it up for sure.
Go ahead. All right, you want to put your question in the chat so we can ask the panel. And if there are any other media colleagues online who have questions, you can put them in the chat as well.
Stephen, while we wait, just want to remind the public that the flu vaccine is available in our health centers. And even though our numbers are not increasing, certainly persons would have seen media reports coming out of the UK, etc., about the rising numbers of flu cases. And so we would encourage persons to get the flu vaccine. It is available in our health centers, and especially for those at-risk groups, the persons at extreme of ages and the persons who have comorbidities, to remember that you can get it to protect yourself. What we see circulating in the media, from the media reports and from our PAHO reports, are the H1N1 and H3N2, and both are covered by the vaccine. So please go out and get your vaccine.
All right, thank you very much, CMO. So Christopher is asking, do we have the number of social cases at the different hospitals? Do we have that data? He's also asking, the study being done at the 4 hospitals for possible relocation, is there a cost for that potential work that is to be done, and how long will the study be expected to be?
All right, so the numbers for social cases are moving target. So that's why I said anywhere between 3% and maybe even 10 in a peak arrangement. So if a hospital has 250 beds, then you know what 5% of that would be. But I can't give any specific number, but it varies. Normally in the season of holidays, it tends to go up. as I understand it. CMO can speak more about that. But we do know that in the case of Falmouth, we have to find somewhere to put the 30 or so that were originally at Cornwall Regional. And given the displacement of that facility, we have to address it. The other issue around the study, right. So it's a collaboration with IDB. I don't have the figures here. It's a rapid study. So I think the intention is to get a firm that can do the ecological. It's a number of things. It's an assessment of the environment, the area, the likely risk into the future of impact. What kind of structure would have to be built in order to withstand that impact, whether it would be better to be relocated elsewhere rather than face that risks, and what is required to mitigate against that risk. So there are a number of questions that will be contained in a terms of reference. My understanding is that they're trying to get some feedback on that early new year, meaning in the first quarter, so before March, could be earlier than March, and that's why they're moving quickly. The result of that will lead to a conversation with the IDB. Of course, all of this governed by the Cabinet of Jamaica and the Prime Minister, and the attempt of a coordinated approach to determine what will happen with not 5, but 3 hospitals, Black River, Falmouth, and Noel Homes, the 3 hospitals that are literally on the coastline, to determine should we rebuild or strengthen them in their current location, or should a relocation of one or all 3 take place in the interest of building greater resilience. And the projectization of that will be a function of what that rapid study suggests, the ecological study, and how it will be funded, whether through IDB or otherwise. It's a longer term effort. It's not going to happen in 1 year, which is why we have to restore them now. It's going to happen over the longer term, but it's necessary nevertheless, and this represents an opportunity to explore that possibility.
I'll hand back to you, Minister, for closing.
All right, so a lot has been said. I don't want to detain us much longer. I'm on my way now to St. Anne's Bay for a handover. What is it that I'm handing over again, or I'm receiving? Electronic, right. Electronic immunization records registry at St. Anne's Bay Health Center. And then from there to Falmouth Hospital, where we are gifting our staff cleaning materials. We're pivoting away from food. The trade is open, but people are cleaning up. And then from Falmouth to Cornwall Regional, we'll be doing the same. So a very busy day. But I want to thank the team. I really want to thank the team again. I want to thank Senator Thompson. Just came in, and I did recognize him during the program. His assignment around operating theaters, which he completed the study. A very good, useful study. And we're going to be working a program on that now. So I want to thank him. And of course, my colleague, Minister Crystal Lee, working on the staff welfare. The rest of the team here are the technical people, Dr. Webster Carr, Dr. Bisesa McKenzie, and Dr. Goldburn, and others in the room in the background, who are also very critical to the process. We may or may not have another session of this kind before the holiday season. We're leaning more not to, but we'll send out releases or statements as necessary. And that's why we spent some extra time talking about the season. If we don't, or if I don't speak to you before that time, I want to, on behalf of the health team, wish all a very reflective season, a season to rest, to give thanks for life, to appreciate good friends and family, but also one with a special consideration to help and to reach out to those in the area that has been impacted. And take care of yourselves. Let's all rise in the new year together, and not miss anyone. Take care of your loved ones and friends. God bless, and we'll keep in touch. Have a healthy season, one and all. Thank you.